Hello, my good people. Welcome to my health talk show as we keep on educating each other. First of all, I want to say Happy New Year to each and every one of you. God has given us life, and we have started this new year, and we want to say that we hope that it will be a good year. So, basically, today I want to talk about one of the things that basically many times especially women don't know about. So today we want to talk about what we call danger signs during pregnancy. So if you are a pregnant woman, I want you to listen to this because this is very, very important. If you are a pregnant woman and sometimes you don't know what we call danger signs during pregnancy, then you gotta listen to this. So basically, I want to talk about around 10 danger signs during pregnancy that you need to watch. So if you see any of those signs, either one or two or all of them, you need to rush to the hospital as soon as immediately so that you can be attended to. So number one, vaginal bleeding, or sometimes others call it spotting. Bleeding or spotting, it's all about bleeding. So if you are bleeding during pregnancy, that means that is one of the danger signs. Leave alone, there is what we call implantation bleeding or implantation spotting. That is very normal, especially the first few weeks after you become pregnant. That is normal. But when you talk about vaginal bleeding, this is bleeding above the 2 months or and above of pregnancy. So if you are bleeding, be it just mild bleeding or heavy bleeding, that is one of the danger signs, and you need to rush to the hospital for attention. Some of the causes of vaginal bleeding in pregnancy could be placenta previa, or rather placenta previa. This is basically when the placenta is located in the lower part, the lower part of the uterus, just near the cervix. So that's one of the things that can cause bleeding, especially in the first or second trimester. Another thing is what we call placenta abruptio. So placenta abruptio here is when there is a sudden untouching or detaching of the placenta from the uterus. So those are some of the main causes of bleeding in pregnancy. So other causes could be things to do with maybe trauma. Somebody gets trauma on the tummy. Sometimes things are blighted over. It can also cause that kind of bleeding. So if you are bleeding, rush to the hospital and get attended to. Number two, convulsions. Call it fits or call it seizures. So if you have convulsions, that is one of the main danger signs that something is wrong. Some of these convulsions can be caused by infections, the likes of malaria, meningitis can also cause this. But again, another main cause of convulsions in pregnancy is what we call eclampsia. Eclampsia is where there is what we call proteinuria, and high PPs in blood pressure, or rather in pregnancy. So those are some of the things that can cause convulsions. So if you are convulsing, you need to be rushed to the hospital as soon as immediately, because this can be a very dangerous state in pregnancy. Number three is what we call severe abdominal pain. It's normal to have some mild abdominal pain in pregnancy. That is understandable. But if you are having a very severe abdominal pain, that can be a very dangerous sign. It could be an earlier sign that you are maybe getting what you call early labor or preterm labor. It can be also a sign that you're actually miscarrying. So if you're having a very severe abdominal pain, rush to the hospital and get attended to. Another danger sign, that is number four, is what we call severe headache which is associated with blurring of vision. Severe headache that is associated with blurring of vision. So this is one of the danger signs that something might be wrong. Could be your pressure is going so high, could be your blood sugars also misbehaving. So if you are having a severe headache associated with blurring of vision, you need to rush to the hospital and get attended to. Number 5, extreme fatigue and weakness. If you are, it's normal to sometimes to get fatigued in a pregnancy. You feel you don't want to do anything, you want to rest and all that. But if you are having an extreme fatigue or tiredness, in that you are not even able to wake up from your bed, you are not able to do your normal household chores, it means something is wrong. Sometimes you might be having anemia, which that is low level blood, and which can cause that kind of weakness. So if you're having extreme fatigue and weakness, see your doctor as soon as possible. Another danger sign, that is number 6, is what you call reduced fetal movement. Reduced fetal movement or no fetal movement. So basically, most women start perceiving the movement of the fetus at around around 20 weeks of gestation. Although for those ones who have been pregnant 2-3 times, they might perceive their fetal movement and maybe at the gestation of around 15 weeks. But most of the time, from 20 weeks, you should be feeling your baby moving, called Braxton Hicks. So if you feel that your child is no longer moving or there's no movement in your uterus, it means something wrong might be happening. So you need to rush to the hospital to have your child checked if everything is okay. Number 7, severe swelling of feet and even the face. It's very normal to have what you call edema, which is associated with a pregnancy. But if you are having swelling which is extreme and it's on the feet and on the face, then that is a very severe, or rather one of the danger signs, and you need to rush to the hospital to be checked. Number 8, excessive and severe vomiting. It's very common, it's very normal to have such kind of problem in pregnancy. Most of the women, especially the first trimester, they do get those severe, rather vomiting. But if it's to the extreme, in that you're not able to retain anything orally, it means there is a problem. You may get dehydrated, you may lose a lot of electrolytes, and this can harm your baby. So if you are not able to retain anything orally and you're vomiting everything, you need to see your doctor. Another thing that is number 8, rather number 9, fevers that does not subside. Extreme fevers, your temperature is high, 38, 39, 40 there, it means you could be having a severe infection, and this can lead into even someone getting a miscarriage. So if you're having a very severe, rather high fevers that is not subsiding even with antipyretics, you need to see your doctor. And then another danger sign, that is number 10, is what we call breaking of your water. We call it premature rupture of membranes. So when you have not reached term pregnancy and your water breaks, it means you are likely to even get early labor. It means your child is exposed to even infections because that amniotic fluid is the one which protects and cushions the baby. So if you are getting your water breaks earlier before your onset of labor, that is one of the danger signs. So basically, those are the 10 main danger signs. I may have not exhausted all of them, they are very many, but those are the main major what we call danger signs in pregnancy. So if you're a pregnant woman and you experience any of those, kindly rush to your hospital, reach to your doctor, and get attended to. Otherwise, I want to wish all the pregnant women All the best as you carry your pregnancy into term. Lastly, I want to say that if you have any question, reach me on my inbox, call me, reach me on my WhatsApp. Also, I want to say that support me by subscribing to my pages, liking my pages, following me on my pages, also on my YouTube channel. Kindly subscribe so that we keep on educating each other. My name is Dominic, and my Facebook page by the name of Simo Dominic. Healthy Talk is my other page. On YouTube, my page, or rather my channel, is Simo Dominic. Kindly subscribe and let us keep on educating each other. I wish you well and a happy new year.